Hello and welcome once more to my channel, Background Health. On today's episode, I'll be discussing cholesterol. Chances are you or someone you know have been told they have high cholesterol. And then you wonder, is this a new disease? What is cholesterol? What are the symptoms? Where did they come from? What did I do to deserve it? What can I do to lower my cholesterol? What can it do to my body? Let's go through them one by one. In the first place, having cholesterol in your blood is not a bad thing. Cholesterol are part of a normal human body. They serve critical functions. For instance, a lot of the cells in your brain are made of cholesterol, and cholesterol helps to stabilize the outer walls of various cells in the body. Additionally, cholesterol help you to form hormones in your body, such as estrogen, testosterone, the male and female hormones. They also help you to form chemicals such as cortisol. Vitamin D also derive its formation and the skeleton from cholesterol. There's something called bile acid, which is used to digest foods in your gallbladder and your digestive system. A lot of them have their building blocks from cholesterol. And so, with all this in mind, it is important to know that having cholesterol in your body is not bad thing. It is part of nature. However, what is bad is high levels of cholesterol. And so you wonder, what does high cholesterol do to your body? This is one of the things that I'd like to discuss on today's channel. To understand why high cholesterol is bad, let's look at these blood vessels. Here you see a normal blood vessel. These things here are blood cells, and the liquid are the blood liquid of the blood. Together they form blood. This is the inside of a blood vessel. You see blood flowing very well. This is a normal blood vessel. However, when you have high cholesterol, it begins to attach to the walls of your blood vessel, causing narrowing, causing this thing called plaques on the walls of your blood vessels. This makes it difficult for the blood cells and the blood to flow through your blood vessels. And when this happens, it's a condition called atherosclerosis. And atherosclerosis have several health consequences. Many of those health consequences will lead you to emergency room, can cause you sudden death. And so let us examine some of those one by one. When you have narrowing of the blood vessels in your brain, that will cause sudden stroke. When you have sudden narrowing of the blood vessel in your heart, that's called heart attack. If you have a cut off of circulation to one or both of your legs, that's called ischemic leg. It can cause a condition called gangrene, and gangrene will lead to amputation, as in this picture. And so that's ischemic leg disease due to atherosclerosis. On the other hand, if you have narrowing of the blood vessels to your intestine, that could cause something called bowel ischemia, which causes you to have belly pain when you are eating food. So if you are at least over the age of 50 and you notice that each time you eat, you start to develop severe belly pain, making you to avoid eating, well, it could be ulcer, but also it could be this condition called mesenteric ischemia due to atherosclerosis caused by high cholesterol. Now that you have seen the different things, especially bad things that high cholesterol can cause, perhaps you are wondering, what type of cholesterol number should I be looking for? For one thing, different labs give you different reports of different types of cholesterol. So knowing what number they give you will help doctors interpret whether you have high cholesterol or low cholesterol. So now I will examine the different types of cholesterol number of reports that you may receive when you get your lab result. Depending on where you live and the ability of your lab, they may give you a report which is called total cholesterol here. However, the total cholesterol doesn't tell you a good picture as or to whether or not you are at risk. Within that total cholesterol, there's something called HDL cholesterol, which is actually a good type of cholesterol that protects you against developing atherosclerosis, which is the narrowing of your blood vessels. Within that total cholesterol, there's also the LDL, which is the very bad cholesterol that is responsible for causing narrowing of your blood vessels. There's also something called VLDL, a type of bad cholesterol that can also contribute to LDL level. There's something called triglyceride, a type of fat that when the level gets very high can also contribute to narrowing of your blood vessel. And there may be something called non-HDL, which is a mixture of things that can be bad, could be good, depending on the ratio of those other components. But I want to focus on these three things here, the HDL, the LDL, and the total cholesterol, because those are the things that matter, very important, because those are also the things that are most commonly reported. So at this point, we're probably wondering what type of number should I be looking at? Well, unlike high blood pressure or diabetes, where you're looking at a specific number, the number that you look for in cholesterol is more complex than that, because what is normal for one person may not be normal for another person. Your risk of developing medical complications, those that I have described above, depending on your history. Some people who have already have either a stroke or stroke symptoms or heart attack may need to have a lower number for especially the LDL. For those people, they want to keep their LDL less than 70. They are talking milligrams per deciliter. In other countries, they use different units to measure, so that 70 may not be applicable, but convert it to the units that are used in that system. For people who have not had any of those conditions but who have diabetes, it may also be reasonable to keep it close to 70, but preferably less than 100 for the LDL. For all others who have no risk factors that I mentioned, no diabetes, no high blood pressure, and no family history of heart attack, etc., those people, your doctor will review your system and determine what the target goal should be for you. With that in mind, there's other components of the cholesterol measurement, something called apolipoproteins, that also may be measured, and the ratio need to be calculated in order to come up with appropriate number. In some instances, your doctor may aim to raise the level of your good cholesterol called the HDL. So the lesson here is that when you get your cholesterol, when they tell you your number is high, you need to know whether they're talking about the total cholesterol, the LDL cholesterol, the HDL cholesterol, and your doctor need to have a discussion with you before starting treatment. Before we start discuss treatment, I'd like to discuss something. Where do cholesterol come from? For one thing, majority of the cholesterol that is in your body, about 80% of that, is made in your liver, while the rest of the 20% of that is the component of your diet, your lifestyle that you have. So the next thing is, how do I lower my cholesterol? Well, several things. Attempt to lower your cholesterol. Majority of your lifestyle thing that you do will aim at things you consume. You need to consume less fatty food. If you eat meat, red meat, try to limit the amount that you eat. Try to find the lean meat. If you eat poultry, chicken, etc., make sure you get the lean one, not the fatty ones, especially the ones that grow very rapidly with hormones that have lots of fat. They have high cholesterol. Other things like shrimp can also have a high cholesterol. Certain type of fat that people use to cook, such as animal fat, increase your cholesterol level and put you at a higher risk. On the other hand, things like vegetables, certain type of nuts, certain type of vegetable fat, such as olive oil, avocado oil, may be healthier for you compared to palm oil. So you need to look at each one of them. Do they have a saturated fat? Do they have cholesterol, etc.? Try to aim it. Exercise and losing weight can also help. But above all, your doctor may prescribe medications, and the most commonly prescribed medication fall in the category of what we call the statins, such as atorvastatin, simvastatin, rosuvastatin, etc. Those medicines are very, very powerful in reducing your cholesterol level. If your doctor prescribes it, please take it religiously. It can lower your risk of heart attack, stroke, gangrene of your intestine, or gangrene of your leg, and can save you from having amputation. However, if you're taking the medication and you are experiencing side effect, please discuss with your doctor to see what can be done, because there's other categories of medicine. On the other hand, if you're taking the maximum dose of the prescribed medicine and your cholesterol level is not coming down, there are other medications that your doctor can add. Or if you're having side effects, there's a different type of medication, although some of them are far more expensive, that your doctor can prescribe for you. Above all, you may not have and you should not have any particular symptom, because I know some people will be wondering, what kind of symptom do I have if I have high cholesterol? High cholesterol by itself is not a disease, but it contributes to other diseases, as mentioned. Therefore, no specific symptom that you can say indicate that you have high cholesterol. Now, how often should you check your cholesterol? I do recommend that if you are over the age of 50, you should check your cholesterol at least once every 5 years. If you are over the age of 50, or if you have diabetes, high blood pressure, certain type of kidney conditions, you smoke, you are overweight, consider checking your cholesterol at least every 2 years or more often. And if you're taking medication, perhaps your doctor may check it once a year to make sure that you are meeting the goal. Remember that the goal for cholesterol control is not a specific number that fits everybody. There's no one size fits all. So instead of saying normal cholesterol, you say target cholesterol level, which is target based on your risk factors. So thank you very much, and please subscribe to my channel. Until next time we present other information to help you improve your life. Please subscribe and leave me a comment.